tell you something that most men over 40 are completely unaware of. And once you hear it, you never look at your kitchen cabinet the same way again. There is a combination sitting right there in your home, two ingredients that most people already own, and when you bring them together in the right ratio at the right time, something remarkable happens inside your body. Your blood vessels begin to behave younger, they become more flexible, they become more responsive and more capable of delivering blood flow your body depends on, including the kind of blood flow that directly affects male performance and vitality. I'm Dr. Emmanuel Balle, and today we are going to talk about extra virgin olive oil and apple cider vinegar, not as separate remedies, but because together the science behind what they do is something you genuinely need to understand. And stay with me until the end of this video because I will be giving you the exact ratio, the exact timing, and the exact method of preparation. Miss any part of this and you won't get the full effect. And also if this kind of practical evidence informed content is what you've been looking for, go ahead and subscribe to the channel and leave me a comment. It tells me you want more of this and I will keep delivering it for you. First, let's talk about what happens to your blood vessels over time. Most men think about their health in terms of weight, in terms of energy or strength, but underneath all of that, the real conversation is about your blood vessels and how well they are doing their job. Here is what I want you to picture. Your blood vessels are not simple pipe, they are living dynamic tissues. They breathe, they respond, and they expand. They contract depending what your body needs from moment to moment. When you are younger, they do this effortlessly. They are elastic, they are pliable and quick to dilate when blood flow is needed. But somewhere around your 40s, things begin to shift. And this shift is quiet, which is exactly what makes it dangerous. The inner lining of your blood vessels, called the endothelium, begins to lose its efficiency. The endothelial cells that lines the inside of every vessels you have are responsible for producing a molecule called nitric oxide. Now, nitric oxide is the signal your body uses to tell blood vessels to dilate and open up. And without enough of it, your vessels stay narrower than they should. They become stiffer, they become less responsive. And at the same time, the smooth muscle tissues within the vessel's wall start to harden and cholesterol, calcium, and other substances begin to accumulate, a process that gradually narrows the diameter of those vessels from the inside. Now, here is where I want you to really pay attention because this is where things become very specific for men. The blood vessels that supply circulation to the male reproductive tissues are some of the smallest vessels in the entire human body. We are talking about a diameter of roughly 1 to 2 millimeters. That's already a narrow margin. So even a modest reduction in the flexibility, even a small amount of plaque buildup can meaningfully disrupt blood vessels to that area. This is why men in their 40s, their 50s, and 60s often experience declining performance that has nothing to do with hormones and everything to do with the vascular health. And the good news is this, and I mean genuinely encouraging news, is that these vessels retain some capacity for recovery. Your body is not done. It hasn't given up provided you give it the right support. The endothelium can restore some of its function. Nitric oxide production can improve, flexibility can return, and that's the entire foundation of what I'm sharing with you today. So what does extra virgin oil actually does inside your body? The Mediterranean diet has been studied for decades, and one of its most consistent findings is that population who use olive oil as their primary fat source have measurably better cardiovascular and vascular health as they age. But most people consume olive oil without truly understanding why it works. The primary fat in extra virgin oil is oleic acid, which makes up somewhere between 70 and 80% of its fat content. Oleic acid supports healthy cholesterol balance. It reduces the kind of chronic low-grade inflammations that silently damages the blood vessels walls over time, and it helps maintain the structural flexibility of artery walls, which, as we just discussed, is critical as you age. But the oleic acid is only part of the story. Extra virgin oil also contains a class of compound called polyphenols, specifically oleocanthals and the hydroxyl tyrosol, among others. These are potent antioxidants and anti-inflammatory compounds. In some research, their anti-inflammatory activity has been compared favorably to the effect of some common anti-inflammatory medications, and that's a significant statement. Beyond the inflammations, these polyphenols they play a protective role against the oxidation of LDL cholesterol. When LDL cholesterol becomes oxidized, essentially damaged by free radicals, it becomes one of the primary drivers of plaque formation inside vessel walls. Olive oil polyphenols actively help to prevent that process. Now, here is the piece of the puzzle that most people miss entirely. These beneficial compounds, the polyphenols, the oleic acid, they are fat soluble. That means the way your body absorbs and use them is fundamentally different from water soluble nutrients. Fat soluble compounds need a specific environment to be fully absorbed, and that environment is acidic. Their bioavailability increases significantly. That's where apple cider vinegar enters the picture. So what does apple cider vinegar brings to the equation? You see, apple cider vinegar is made through the fermentation of apple juice, and its primary active compound is acetic acid. And acetic acid has been studied extensively for its influence on blood sugar metabolism and insulin sensitivity. And the findings are consistently meaningful. When you consume a modest amount of vinegar alongside a meal, it slows the rate at which the carbohydrates are broken down and absorbed. And this moderates the spikes in blood sugar that typically follows eating. And this matters enormously for vascular health because elevated blood sugar over time damages the blood vessels through a process called glycation, which essentially means sugar molecule attaching to proteins in vessel walls and causing them to stiffen and lose elasticity. But the benefit of apple cider vinegar extend well beyond the blood sugar. Acetic acid influences the body system involved in the blood pressure regulation. It supports the healthy blood pressure partly by enhancing the production and the sensitivity of the nitric oxide. The same molecule we discussed earlier, the one that signals your blood vessels to open and relax. So in a very real sense, apple cider vinegar is supporting the same biological pathway that aging endothelium is struggling to maintain. There is also evidence that the organic acid found in apple cider vinegar have what's called chelating property. This means they can gently bind to some mineral deposits, including calcium, which may over time support the gradual clearance of certain buildups within the arterial walls. This is not a dramatic or immediate process. It requires consistency and patience. But for men who are committed to long-term vascular health, this is the meaningful piece of the picture. So what happens when you combine them? This is the part I want you to sit with for a moment because the interaction between these two ingredients is where the real science becomes genuinely exciting. When the when olive oil and apple cider vinegar are consumed together, the acidic environment created by the vinegar significantly enhance the absorption of the fat-soluble polyphenols in the olive oil. Compounds that would otherwise pass through your system without being fully absorbed are now being taken up more efficiently by your body. You are getting more out of every drop of olive oil when it's paired with vinegar. At the same time, both ingredients contains their own populations of antioxidant compounds and they target different types of oxidative stress. Combined, they offered a broader spectrum of protection than either one provides alone. So the anti-inflammatory effect of this pairing also appears to be more simply addictive. Research into combined antioxidant and anti-inflammatory agents consistently show that the right combination produce effect greater than the sum of their parts. Inflammation in the endothelium drops more significantly when both compounds are present together. And critically, olive oil nourishes and protects the endothelial cells themselves, while the apple cider vinegar enhances their activity and responsiveness. So together they create a condition. Your endothelium needs to produce nitric oxide more effectively, which translates directly to improve vascular flexibility and blood flow. So here is the method, the ratio, the preparation, and the timing. Now let's go practical. Here's exactly how to do this correctly. Now for the olive oil, quality matters enormously. Choose extra virgin oil that is cold pressed, stored in a dark glass bottle, and ideally has a recent harvest date printed on the label. Freshly harvested olive oil contains significantly higher concentrations of polyphenols, and older bottles sitting in a clear plastic container is not going to deliver the same benefit. Then for the vinegar, use raw and unfiltered apple cider vinegar. You recognize it by the cloudy appearance and the sediment at the bottom of the bottle. This is called the mother and it contains preserved enzymes and beneficial bacteria that contribute to the vinegar's effectiveness. So the ratio I recommend is 3 parts of olive oil to 1 part of apple cider vinegar. In practical terms, that means 3 tablespoons of olive oil combined with 1 tablespoon of apple cider vinegar as your daily therapeutic dose. To prepare the emulsion, pour the vinegar into a small bowl first, add a small pinch of sea salt and stir it in. Salt assists with emulsification, helping the oil and vinegar come together more uniformly. Then add the olive oil slowly, drop by drop, stirring continuously until you have a smooth, consistent mixture. Now, regarding the timing, there are 2 windows that work particularly well. The first is shortly before or alongside your largest meal of the day. In this context, the vinegar does its most effective work on blood sugar regulation, slowing carbohydrate absorption and preventing the vascular damage that comes with blood sugar spikes. Then the second is first thing in the morning on an empty stomach. Many men find that taking this combination in the morning produces the most noticeable effect on overall energy, vascular responsiveness, and daily vitality. The compounds are absorbed rapidly and set a favorable metabolic tone for the rest of the day. Some men also find that taking it 45 to 90 minutes before the physical activity produce noticeable acute acute improvements in circulation that may be worth exploring once you have established the daily habits. So what to expect and when? I want to set a honest and a realistic expectation because sustainable health is built on consistency, not shortcuts. In the first 2 to 4 weeks, many men begin to notice improvements in digestion, more stable energy throughout the day, and a reduction that in that mid-afternoon slump that so many people in their 40s and 50s accept as normal. This is your body beginning to respond. Then between 1 and 2 months of consistent daily use, measurable vascular changes begin to occur. Blood pressure often trends in a favorable direction, arterial flexibility starts to improve, and this is often felt subjectively as better warmth and circulation in the extremities. By 3 to 6 months, the anti-inflammatory effects have accumulated meaningfully, and this is the window in which most men most commonly report significant improvements in male performance, not a temporary or stimulated response, but a genuine improvement in blood flow quality, firmness, and tissue vitality that reflects real underlying vascular change. This is not a shortcut, it is a practice. And like all meaningful health practices, the men who commit to it consistently are the ones who experience the most profound results. So extra virgin olive oil and apple cider vinegar, two ingredients, one powerful synergistic combination and a real science supported pathway towards a vascular health, better blood flow, and a sustained male performance for men who refuse to accept decline as inevitable. I am Dr. Emmanuel Balle, and I will see you in the next video. Take care of yourself, and don't forget to like this video and subscribe to this channel for more helpful videos like this. Take care of yourself, and bye for now.